In addition to the memory loss and cognitive changes that most people think of when they think of Alzheimer's disease, the damage to the brain also causes behavior and psychological symptoms. These neuropsychiatric symptoms lead to mood and emotional changes and can be disabling. These symptoms are highly stigmatized and frequently dismissed as willful behavioral problems. But the reality is that they often require medical attention. They are as much a product of the disease as changes to memory and occur as different parts of the brain are damaged by the disease. In this video, Dr. Carolyn Clevenger, director of Emory's Integrative Memory Care Clinic, shares her expertise when it comes to managing two related neuropsychiatric symptoms: anxiety and depression. What is anxiety and depression in Alzheimer's disease?
Anxiety and depression are some of the first symptoms I see emerge. They are nearly universal. People become anxious. If you are aware that you're having changes and you know that this is a larger problem that might likely get much worse, it can make you depressed. That would be situational. There are also, though, changes that happen in the brain as part of this disease, and that changes both the structure of the brain and the way that it executes all of the things it should be doing. Typically, anxiety and depression emerge slowly, they're gradual. Everybody has good days and bad days. We all do. Maybe you just didn't sleep well the night before. When we start to have low days, and those are consistent. In fact, we've got 4 out of 7 days in a week where we are so low that we're having trouble getting out of bed. We are not cleaning our plate when we're usually part of the Happy Plates Club, right? So appetite has changed. Then we know that we have something that probably needs an intervention of some sort. That's a good time to talk to your healthcare provider. Rarely does anxiety or depression represent an emergency when it first arises.
What are the symptoms of anxiety and depression in Alzheimer's disease?
So in anxiety, you might see more restlessness, more repetitive questioning or repetitive movements. Sometimes it looks like rummaging, pacing. So those are more active symptoms we often associate with anxiety. In depression, what we might see is less activity, less engagement. And so that might look like someone who's staying in their apartment or room or home more. Maybe they're not participating in family activities or social gatherings like they would have in the past. What we might see are changes in weight, changes in sleep, changes in appetite overall, and sometimes, particularly in depression, changes in pain.
How are anxiety and depression in Alzheimer's disease diagnosed?
One of the challenges with the standard screeners for anxiety and depression is that they are not developed specifically for people living with Alzheimer's or other dementias. They might be helpful, though. Some of those same questions may be very helpful in getting at the symptoms that this person is experiencing. And the person who's experiencing anxiety and depression, who also has Alzheimer's disease, is going to have a varying degree of ability to answer those questions accurately or recall things that they've experienced in the last 2 weeks, for example. So some of our standard screenings are the personal health questionnaire, which often begins with just 2 questions. The full scale is 9 items. There are other tools like the geriatric depression scale. The questions that are in those specific scales can be very helpful for a clinician because in my experience, the clinician interview is going to be more valuable rather than using a standard scale and expecting that those results are going to be just as valid as they would be in someone who's not living with Alzheimer's disease. The other very important component to that clinician interview is that it should be conducted both with the person living with Alzheimer's disease and ideally with someone who observes them closely on a regular basis, maybe someone they live with or someone who's close to them.
How are anxiety and depression in Alzheimer's disease managed and treated?
Anxiety and depression in Alzheimer's disease have a slightly different treatment plan, but we always begin with putting strong supports around this person. And that also may depend on their specific symptoms that they're experiencing with their depression. Some things can create a cycle and make, for example, depression worse. So if you have pain chronically and your pain is poorly managed, that can worsen depression. Worsening depression also worsens pain. And so it may be sort of multiple components depending on exactly how their depression manifests or their anxiety manifests for them specifically. Cognitive behavioral therapy, very helpful. but depending on the stage of Alzheimer's disease may be less effective at later stages. Cognitive behavioral therapy requires someone to be able to consider what they're experiencing, to process it, to have that logic and reasoning, those things that are available to most of us where we can rely on our brains to do those for us. They may not be able to do those. Certainly, I think about environmental modifications. I've found great success, honestly, with weighted blankets for people who have anxiety, particularly if it peaks at certain times of day or in certain scenarios or contexts. And then, of course, we think about pharmacotherapies for all of these, for anxiety and depression.
What happens when managing anxiety and depression becomes too difficult to manage?
If we truly, as a team, and that means the patient, the caregiver, care partner, your clinical team, are having tremendous difficulty managing anxiety and depression, that is sometimes when patients require a psychiatric stay, either through a day program or an overnight stay in a hospitalization where we really need to adjust medications because we're at crisis level. Depression in Alzheimer's disease deserves a very special look and aggressive treatment and intervention because our highest suicide rate is among older adults with cognitive impairment potentially.
What can be done if anxiety and depression progress?
All of our bodies change every day, and even we think about when we're adults, things are pretty stable. So I've been on this medication for some time. It's always worked for me. Why wouldn't it continue to work? Well, your body keeps changing, and when you have Alzheimer's disease, your brain is changing more rapidly than would be expected. So what worked for you 5 years ago, what worked for you 2 years ago may no longer work. It may be that that particular agent is no longer the right fit, that dose is not the right fit. Maybe it requires what we call an adjuvant therapy, so sort of a supplemental medicine to make the first medicine work a little more effectively than it used to. And so your symptoms will change. Sometimes they get worse. Sometimes they get better. I don't want to paint the picture that it always gets worse, but certainly you want to keep an eye on it, and things will change.
Anxiety and depression are medication conditions that can be treated to lessen the burden of an already devastating disease. For more information and resources, visit agingresearch.org/NPS.